Hi everyone, my name is Hércules Ribeiro Leite. I'm a professor and researcher at Federal University of Minas Gerais in Brazil, and I'm here today recording this podcast on behalf of the co-authors of the paper F-Words Ingredients of Non-Invasive Interventions for Young Ambulant Children with Cerebral Palsy, a scoping review. First of all, it's very important to acknowledge and recognize the rationale of our present paper. So, as you know, in the past few years, knowledge about cerebral palsy has grown along different front lines, such as diagnosis and prognosis, tools for assessments, interventions, and models to optimize the rehabilitation approach and management. However, despite these advances, disparities are still seen worldwide, with difficulties in applying best evidence practice, especially considering the enormous variety of intervention labels. So, it's very important to promote, to foster strategies to communicate better with clinicians and to use a common language, for example, using the F-words for child development and the RTSS. So, both models I'm going to explain better in the upcoming slides. So, first, the F-words. So, as you know, the 6 F-words: functioning, fitness, friends, family, fun, and future. They were developed and grounded in the ICF framework, and they are composed of a group of linked ideas aiming to bring contemporary ways of thinking about child development to daily life. And the F-words have been used by previous studies, for example, to extract and map data. A recent study described an operational procedure using expert panels to identify published intervention ingredients and related F-words for young children from 0 to 5 years of age with cerebral palsy, but classified as GMFCS levels 4 and 5. And now the idea is to go further and also investigate the ingredients, the F-word ingredients, but looking at children with cerebral palsy, young children with cerebral palsy, but classified as GMFCS levels 1 to 3. Additionally, when investigating the ingredients of interventions for young ambulant children with cerebral palsy, as I have mentioned, it's very powerful to use the F-words, but also it would be useful to use a standardized language to improve the quality of the treatment specification by rehabilitation clinicians. And this gap might be addressed by the Rehabilitation Treatment Specification System, the RTSS. The RTSS is grounded in treatment theory and is a conceptual model designed to enhance common language in rehabilitation treatment. The RTSS allows clinicians to identify ingredients, mechanisms of action, target, and aims. Ingredients are defined, might be defined as components manipulated by the therapist when conducting an intervention. Mechanism of action is defined by how the ingredient is supposed to work. Targets are defined as outcomes directly changed by the main ingredients. And finally, the aims are defined as outcomes indirectly changed by the main ingredients and or by other non-essential ingredients. So here we have an example. So if we have an intervention such as task-specific training for children with cerebral palsy, the ingredients might be, for example, structure and repetitive task practice. The mechanism of action, learning by doing. The target, the outcome, the target is the directly outcome, such as task performance. And the aims, the indirectly outcomes, such as participation in different environments. So, considering the rationale that I have just presented here, during this presentation, our goal was to map the ingredients of non-invasive interventions provided to young ambulant children with cerebral palsy, combining the F-words model and the RTSS model. Articles were screened and studies characteristics extracted. The interventions ingredient were described in terms of the RTSS and linked to the F-words for child development as well. Results were interpreted and validated by a patient and public involvement PPI group. So now I'm going to start presenting the results. The idea here is just to tease you to download the full paper and then read afterwards. And here we can see clearly that the included studies, a total of 27 interventions, together present ingredients representing all the F words, especially for fitness and functions. The ingredients related to the F word feature were the most infrequently reported. From the results of this scoping review, and in order to help the interested parts to identify and understand treatment components, and such as ingredients, mechanisms of action, targets, and aims, and also using the F words to translate it into pediatric rehabilitation language, we have built a new F word tool entitled the F words lens tool in order to identify intervention components. So if you have the chance to download the full paper and read the full paper, you're going to see a big picture like that, representing our results, representing the ingredients, considering each F words, and considering and taking into account the F words lens tool. And you're also going to have the chance to download a template for using in your clinical practice. So in conclusion, we identified that intervention ingredients for young ambulant children with cerebral palsy were related to all F words. Fitness and function ingredients were the most commonly found in non-invasive interventions for young ambulant children with cerebral palsy, and more interventions are encouraged that are aimed at fun, friends, and future for young ambulant children with cerebral palsy. We hope to share soon the manual of the F words lens tool. So stay tuned at Kenchai website. Thank you very much.